All right. I'm excited to be here with TMA President Ray Callas. Thank you so much for joining us today.
Yes, sir. I'm glad to be here. I'm glad you invited me to come, Eddie. I really do appreciate it.
Absolutely. So, I want to ask you a question. And when end of the year, when we go through our professional organization memberships, we sign up and we're paying this money to our county and our state-led organization. Of course, for neurologists, we have the Texas Neurological Society that's sponsoring this. We have the American Academy of Neurology, and you're very active with both TMA, which you're current president, AMA. Can you tell me a little bit more about the importance of actually, paying that membership, putting up that money, and getting involved? We talk a lot about advocacy, but not just advocacy, also the networking that goes into it and everything else, the benefits of getting involved with the organizations.
Well, let me just start off by saying that if we don't get engaged, people will engage and tell us how we need to practice. And that's a very big concern for me. I do understand that it costs money to be members of, like you said, neurology, both at the state level and at the federal level, just like for me as an anesthesiologist, a member of the Texas Society of Anesthesiologists and the American Society of Anesthesiologists. But with that being said, I know that it's very important for me to be engaged in my specialty, and it's definitely very important for me to be engaged in Texas. So I would always recommend that we definitely open our checkbook and we pay both of those different dues. I'm not going to sit here and tell you that that it's cheap, but I'm also telling you it's well worth the spend. I will tell you that in the state of Texas, thank God we have the Texas Medical Association. We are almost 60,000 members strong, and the reason why that's so important is that whenever we speak and we speak together, we're very loud. And people respect what we're talking about. I mean, we're blessed to live in the great state of Texas, all because of the great medicine that we deliver, but more importantly, the physicians that believe. What I really want to see, Eddie, my dream is to have every member that's a physician be a member of the Texas Medical Association. And it's not about the money. It's not about creating revenue. It's about saying we're one. We're one voice. And I mean, it's I'm passionate about this because I do believe that the more and more people that join, the stronger we will be. Absolutely. And I think the stronger voice we have, the better patient care is going to be delivered. So it's well worth it to me, but under no circumstance do I want you to get away from your specialty organization. But I mean, all it is, man, like me and you, we stopped at Starbucks. That was about $11, $12. Say we just didn't do that this month and we don't do it for the next 6, 7 months. Guess what? You'll have that money. Absolutely. So, I mean, and plus, people don't realize what they don't know. You join TMA, I guarantee you're going to get more things than you even think we're all about. I know our number one arm is advocacy, but we do a lot for CME. We do a lot for practice management. We do a lot for Knowledge Center. You can bring up contracts. You can bring up a lot of things. You can also get CME, but more importantly, you can get liability insurance. You can get health insurance because we're connected to TMA IIT and TMLT. Absolutely. But we're an all-inclusive organization. If you're employed, you're private, you're hospital-based, you're an academic, it doesn't matter. We need every person in there to make us stronger. So, I mean, that's what I believe, Eddie. And I appreciate the question, you asking me that.
Yeah, and I often tell, because a lot of times I say that physicians are too reactive. We always are quick to react when stuff happens to us, but we're not proactive enough.
Right.
And if you're not at the table, you're a part of the menu.
Totally agree.
When I agree with everything that you're saying, and really push forward to people that, hey, listen, you can't sit back and complain, because a lot of times they don't understand what all these organizations, from their county medical association to Texas Neurological Society, TMA, AAN, AMA, you may not know what they're doing unless you're stay involved on a day-to-day basis. But these organizations have lobbyists. They have specialty people who go in and can talk to legislators about these particular issues.
Right. Yes, sir. I mean, and what people really don't know is that TMA doesn't stop. We might be in a legislative session every other year, but even whenever we're done at that legislative session, we're working on rulemaking. We're working on the next generation of bills. We're making sure that men and women that put on that white coat, they can lead healthcare. And it doesn't stop. We have men and women that are lobbying for us every day. every day, no matter if they're going to a meeting with the Texas Medical Board, they're going to talk to Texas Department of Licensure and Regulation, they're going to talk to Texas Department of Insurance, they're out there. But the one thing that they also got to realize that being a member of TMA, it's a very proud moment. Because when you say you're a member of the Texas Medical Association, you're saying that you respect and envy all other states. They want to be like us. And you also are putting out there that pledge saying that I want to be that leading physician. And that's what TMA is all about. But you know what I'll tell everybody on this video, and I'm telling you, you know me and you are going to work, no matter if we had one member or we have 400,000 members. And that's a fallacy we need to change. I'm going to work just as hard, just like you are, but it makes it a lot easier when everyone's a member, because you hit the nail on the head. The amount of communication that you receive, you don't even have to go step foot in that Capitol building, but you will be educated by all the amount of emails, newsletters, TMT, everything that we put out. You will be educated, and you will be even better educated so you can take care of your patients, because your concern is my concern, is our concern. And I think that physicians need to know they are always going to be supported by TMA, but please, if you can, become a member. That's what I truly believe.
I appreciate that. It sounds like, you know, healthcare is changing at all different levels.
All the
at
time.
A city, county level, state level, and a federal level. And as physicians, it's important for us to get involved on those levels and be a part of the process so that we can become the change that we want to see in our industry.
Right. I mean, and I'll tell you, Eddie, what really my heart felt, this is coming from me, from my heart. It has nothing to do with being president of TMA. It has everything to be about being a physician. Men and women, boys and girls, no matter where you, race, color, gender, creed, they depend on us. They depend on us. And we should depend on TMA, and we should depend on each other, because your voice, my voice, our voice, if we can make it better, safer, healthier, and we can join together, can you imagine what can happen? That's all my vision is saying, join the TMA, have your voice heard, because it's not about me and you. We're going to do it. We're always going to do it. It's about us making it safer for our patients.
Absolutely.
So, you know, I'm just so passionate about this, because, you know what, writing that check is so easy. Getting involved. You might become addicted to this. I'm telling you, that's what happened to you and me.
Yeah.
I'm just telling you, that's what happened to me and you.
It is addictive.
You know, I mean, and you know what? The reason why I feel good is because even my patients, even today, when I go see them as an anesthesiologist, they're like, thank you for what you do. They thank me for being an anesthesiologist, but they thank you for being the voice of the patient. Because if we are not, like you said, if we're not the one staying engaged, we will be on the menu. Absolutely. And I don't like being on the menu. I like ordering off the menu.
Absolutely. Well, Ray, Dr. Callas, you know, thank you again for joining us. And thank you all for joining us for this edition of The Business of Neurology. Tune in for future installments in this video series and get involved.